Hello and welcome to Finishing Strong. My name is Steve Tanner. We talk here on this program here on 94.1 The Voice about finishing strong in all aspects of life. And one of those areas of life is life itself, pro-life. You hear about the pro-life movement. You're probably passionate about life if you're listening to this radio program, but maybe not. But we have a wonderful resource in our Treasure Valley called Stanton Healthcare. And during this week, going to be visiting with people from Stanton Healthcare, talking about life, talking about the pro-life movement and what happens with folks like Stanton Healthcare. Because this is Sanctity of Life Sunday coming up this Sunday. We have the March for Life coming up this weekend. So all weekend long is Sanctity of Life week here on the Finishing Strong program. So first of all, to start out, I've got a couple of guests here in studio. First of all, I have Leela Afoa. She is the Executive Director of Stanton Healthcare. Leela, thanks for being in here with us today.
Thanks for having me, Steve.
I also have one of the volunteers from Stanton. She's an RN. Her name is Faith Boyd. Faith, thank you for coming in.
Thanks, Steve.
She even came in her scrubs.
Oh. It makes me look more nursey.
There you go, more nursey. Okay, the new word, first time use on the program, I think, nursey. But Leela, let's start with you. As Executive Director of Stanton Healthcare, how did you get involved with Stanton? And talk a bit about kind of the overview of who Stanton Healthcare is.
Sure. Well, Stanton Healthcare has been in the community for over 16 years, Steve. I didn't know if you knew that, but I got involved in it. I was lucky enough to get involved with it pretty early on as a board member. So I got in on at the ground level, and we really talked through the need in the community to help support women in a compassionate way and give them the choice of life and talk through that with them. So 16 years ago, we started, I think, in a chiropractic building. We moved to a church building. And I forget the years, but we acquired our first clinic at Boise. And so it was wonderful not only to have our first clinic, but to have a strategic location. So our Boise clinic was right across from Planned Parenthood, where we were able to meet not only the needs of the people that knew us, but people that didn't necessarily know us. And we were able to walk off the street and come in and get compassionate care. And so my current role as executive director came within the last 6 months, actually. I moved from education and into this role. And I've been looking at not only Stanton Clinic in Meridian, where we grew, I think in 2019, we started that Meridian clinic, and we have the Boise one, and we also have a mobile clinic. So it's been really exciting.
Yeah.
A lot of movement.
Well, that's exciting. Never a dull moment, as they say.
Yes. Yeah.
Why are you passionate about life and the life movement?
Sure. So I am passionate about it because I think women deserve better. They need compassionate care that not only sees the truth of what their actual practical needs, but somebody who is going to partner with them and say, I actually care about you as a person. It's not just about a number at the end of the day, about getting the dollar at the end of it. It's about walking through life with you for not only the mom, but again, the baby too. So it's a family win for me.
StantonHealthcare.org is their website if you want to go and find out more. I'm looking at it right here. There's so much information there, so many resources, so much hope. I go to your website and I see hope there for someone who maybe is really struggling. But you offer services and care for someone who's not at the end of their rope and struggling either. You're a full-on healthcare clinic, accredited and all of that, so that you are able to really assist women in their care in lots of different ways.
Yes, and I'm glad you brought that up, Steve. So care for women isn't just through birth and then, all right, we'll see you next time. It's really about being with them throughout their walk. And so we have now at the Boise clinic, that original clinic has turned into our Boise Wellness Clinic. So to speak not only to when a woman walks through our doors, their first initial needs, but also what about after? What about, okay, I'm pregnant. Now what's going to happen to my body? How does birth look? We kind of partner them into our Boise clinic where we look at the wellness of the woman and of the family too. So it starts with things like birthing classes, prenatal and postnatal massage therapies. We've done different types of parenting groups and classes, just a real support for those women that are needing community.
Well, that's good. She is Leela Afoa. She's the executive director of Stanton Healthcare, stantonhealthcare.org. You're listening to the Finishing Strong program on 94.1 The Voice. My name is Steve Tanner. Also here in studio is a volunteer with Stanton Healthcare. She's Faith Boyd. You're a registered nurse. Faith, why do you volunteer?
Just to care for women wholly, and life in general is so precious. And I think there's so much in the media of just sadness and despair, but this is hope. This is an unborn child that we're getting to help bring into the world, and support the mama all the way, and support her family and what she chooses, and just really help that family grow and grow closer together and show love.
As an RN, I'm assuming you have another job, or you have a job as an RN, or you have had a job as an RN, you're a registered nurse, but volunteering at Stanton, just having a passion for healthcare and helping people, but it's a kind of a different category with this, isn't it?
Definitely.
I mean, with stepping into someone who actually may be in crisis or may be facing some difficult choices to make or decisions to make for a whole family. Talk about how it is different in a volunteer role with somebody like Stanton Healthcare, as opposed to the day-to-day of work as a registered nurse.
Yeah. So I've been a registered nurse for 20 years and kind of done the whole gamut of lifespan, so to speak. This is my first forego into childbirth and pregnancy, and I'm focused more on the education piece. And so we are educating. I'm in charge of the classes, the prenatal classes, the childbirth classes for the moms, and educating them like, this is what's going on with your body and you can do this. You're empowered to do this. This is what you may expect. These are questions you can ask. This is how to approach it. So really empowering them. And so the difference with working with Stanton versus other places I've worked is it's really, we talk about in nursing patient-centered care. And this is really patient-centered care. If there is something that we need for the mom or the baby to help them succeed, I have yet to be turned down a request of like, hey, we need to get this. This is something that's going to help them.
Oh, that's cool. You talk about empower. That's what we're about here with Finishing Strong. You're helping them finish strong in their pregnancy, finish strong with their family, finish strong in staying together and in ministering to a family and really caring for a family. Leela, would you talk about when we think about a place like Stanton Healthcare, and we know the kinds of work that goes on there, and with the pro-life movement and saving babies and these wonderful things, but there's more to Stanton Healthcare than that, and more ways to be involved with it rather than simply as a patient or a client.
Yes. Thank you for asking. There are ways to get involved. We have people like Faith that have come and volunteered their professional services of being an RN and enhancing our education courses based off of her expertise. We have volunteers that sit down and speak with women directly and really partner with them. They know the nuances. So Faith won't share this story, but I will. She knows one of her clients really liked ladybugs, and so made sure that she had ladybug everything in her gift that we give them at delivery. So they just really become the heart and breadth, our volunteers and the people that we work with. That culture becomes the heart of Stanton. It's the living room. It's the people that our clients want to come back and see. So we have one of our babies, not such a baby anymore, but 16 years old.
Wow. Still
comes back and visits.
Oh,
and
that's cool.
I'll tell you, that is the kind of ways that we can get involved. So we look for volunteers that can volunteer not only professional services, but connect with the mission of Stanton and can get in and find something to do. We also have people that plant blueberry bushes outside the wellness center. It takes a village, and we've got some of the best village members.
Oh, that's cool. Having the volunteers, this allows you to then, when someone does come in for care, how much do they pay?
Oh, yeah. Well, we charge our clients. It's free of service for them. It comes at no charge, sorry. But our volunteers, they're volunteering their time, and their time can be valuable.
Wow. So that's the backbone of so many organizations. I mean, I've been a pastor for years, and without volunteers, churches crumble. Without volunteers, people like Stanton Healthcare would crumble. You know, it's a big week this week. It's the first week of the March for Life, first week of Sanctity of Life Sunday since Roe v. Wade was overturned last summer. Yeah. And so it's a big deal, but the fight continues. I read a statistic recently that the World Health Organization, certainly not a pro-life organization, they talk about there's 70 something million abortions happen worldwide still. So the fight continues, and you guys are in the middle of the fight. Thank you for being in that fight and allowing us to hear a little bit more of your story. Anything that I didn't get to, Leela or Faith, that you really, really wanted to talk about?
No, I just really wanted to thank you for the opportunity and for our partnership within the community, because without those partnerships, what we do doesn't happen. And so thank you for letting us be a part of that village and being part of ours.
Well, radio is a very special medium to bring about that kind of thing. Somebody driving down the road right now, they may have just heard that, I can volunteer there? Cool. StantonHealthcare.org. That's where you go to find out about that. Also, to find out about the services they provide and offer there. So check it out, StantonHealthcare.org. Leela Afoa, thank you for your time today. Faith Boyd, thank you for your time today. Appreciate you coming by. This is the Finishing Strong program. We talk about finishing strong in all areas of life, and boy, is this an area where it's so important to finish strong. So again, thanks so much for listening. Thanks for being here with us on 94.1 The Voice. Welcome to Finishing Strong. My name is Steve Tanner. This is 94.1 The Voice. Finishing strong in all areas of life, be it the long game of finishing strong and really living out the life that God has for you, or finishing strong and making sure that you get to work on time tomorrow. Whatever it is, finishing strong. That's what we're about. Well, 2022 was a big year for life and the pro-life movement. And as we are coming up now to the March for Life and Sanctity of Life Sunday coming up this weekend, I wanted to talk with people who are close to the action, and you can't get any closer than the good folks at Stanton Healthcare. And so I wanted to welcome, we're going to be talking with different folks from Stanton all week long, as I'm calling this our Sanctity of Life Week on Finishing Strong. So I want to first welcome Samantha Doty. She's Physician Assistant, Director of Clinical Services at Stanton Healthcare. Samantha, thanks so much for your time.
Thank you so much for having me.
You know, you guys are right in the thick of it, in the battle. We know that last year was a really big year for the Roe v. Wade being overturned in June and all of that. So I want to get to that as we progress through our time today and through the week. But let's just talk a little bit about the things that you're doing there. You're Director of Clinical Services, so you're in the heart of what's happening with Stanton Healthcare and in life. Talk a bit about what are some of the challenges you're facing, some of the excitement that you have in what's happening in your arena.
Yeah, so 2022 was a big year for us, clearly, as Roe versus Wade was overturned. But it was also a big year for us in that we went through a really rigorous process to get a third-party accreditation through AAAHC, which stands for Accreditation Association for Ambulatory Healthcare. It's someone that comes in from outside and certifies that we provide the highest standards of medical care out of any of the medical facilities. So we can't just claim that we provide amazing quality healthcare. Someone else came in and evaluated what we did and agrees with us. And so we have this stamp of approval saying, no, you guys we're not a fake clinic. We're a real medical clinic, and we provide the highest standards of care anywhere in medicine.
And so it's not just an accreditation for like crisis pregnancy centers. This is a healthcare accreditation across the board. Well, congratulations for that. That is really cool to know that, there's lots of people doing really good work with crisis pregnancy centers, pregnancy resource centers, that kind of thing, that aren't really providing health care. They're providing counsel and wonderful resources. but you guys are really in the thick of it on the clinical side.
Right.
And
we're
so,
a medical clinic,
yeah.
and that's important to us.
So being a medical clinic, I mean, you're Stanton Healthcare. StantonHealthcare.org, by the way, is the website. But talk about some of the things that you do. What really turns your crank, charges your batteries, Samantha, whenever you go to work, and the things that you get to do in your work?
Yeah. So when someone finds out they're pregnant, what's the first thing they do? They take a pregnancy test.
Yeah.
So that's where we start too. We start with a lab grade pregnancy test, early detection. If the pregnancy test is positive, we provide limited OB ultrasounds. And then we also offer STD testing. Again, all of this is done with the highest standards of care. Another really exciting thing that we provide that's unique to our office is abortion pill reversal.
Wow, that's cool. And how often does that happen when somebody comes and they say, hey, I've done this thing and can you help me?
So we've had 3 patients in about a 2-year period of time that have started the process. 2 have had their babies, healthy, beautiful babies born. 1 is still in the middle of her pregnancy,
Okay.
But things are going really great.
Wow.
So yeah,
Wow.
And we really anticipate that increasing though. That's with all that has changed.
Sure.
We foresee that we'll see more patients like
And
that.
wasn't there just FDA just approved one of those for over the counter?
So they're going to make it more accessible by allowing pharmacies to dispense it,
Okay.
whereas before the medication was dispensed at the abortion provider's office. So that's the new change. But again, it's just one more thing that our administration has done to try to make abortion more accessible.
No, so oftentimes I hear the line, and it drives me nuts because I know it's not true, but the line that comes back from those who would push back against we who are pro-life, that you guys are only worried about that baby and you don't care about the woman, and you're not going to care about the baby after it's born either. This is absolutely untrue, and I know that, and you know that. But talk about where Stanton is stepping into those gaps to provide that kind of care.
You know, that's a really common thing that we hear is that attack specifically, but it couldn't be further from the truth. We come alongside the woman from the moment that she finds out she's pregnant to truly, we call it an 18-month wellness program. We are with her every step of the way of her pregnancy. Before the baby's even delivered, we're doing parenting classes. We have a lactation specialist that'll do consultations before she's even at the delivery. And then after the delivery as well, we have lactation support. We have ongoing parenting classes. And then we provide supplies. So we're providing not only maternity clothes while they're pregnant, but afterwards, baby clothes, baby diapers, baby wipes, really anything that they need. And I really have a hard time believing that any other type of clinic would provide the type of support for women that we do. So it's almost ironic that that's the claim against us.
Well, she's Samantha Doty. She's Director of Clinical Services at Stanton Healthcare. You hear Stanton Healthcare spots on the radio station. In fact, you hear Samantha's voice on some of those. And so it's really cool to have her in here to talk a little bit more about what goes on with Stanton, StantonHealthcare.org. This weekend is March for Life. It's Sanctity of Life Sunday, and it's something that's been observed every year since the Roe v. Wade ruling in 1973. We don't have a Roe v. Wade anymore, but we're still doing March for Life because there's still lots of work to be done. What are some of the challenges that you see on the horizon for the pro-life movement, but even more specifically for Stanton Healthcare?
Yeah, so as you know, most people know, when Roe versus Wade was overturned, 30 days later, Idaho said essentially all abortions were banned. So some people might say, well, what are you doing now? Well, our work isn't over. It's changed. That's all that's happened. What we're seeing is women are going across the border and they're doing telehealth visits and they're ordering prescriptions through the mail. And now we're seeing an increase in the chemical abortions. So the need has not gone away at all. It's just changed. So because of that, abortion pills are turning the American homes into abortion clinics. It's heartbreaking.
That's horrific to even think about that, that is happening, but we're seeing it. We talk about finishing strong here on this program, here on The Voice, finishing strong with our lives, finishing strong with raising our kids, but finishing strong with delivering our kids, with having good people like you guys to see, to walk with a woman and a man. There's not just one person affected by all this. There's not just one person and her child affected by all this.
It's a whole family.
It's a contagion of people affected, and you guys are speaking into that. What are some things that we should be praying for you guys?
Yeah, so I think the big one for us and getting the word out is abortion pill reversal. So we're taking the woman who has taken their first abortion pill. So there's two pills. Just for explanation, there's two sets of pills you get. The first abortion pill is mifepristone, and it's a progesterone inhibitor. It cuts off the nourishment, the blood supply to the baby. It causes the uterus to become a hostile environment. When they take the pill and they have that moment, oh my goodness, what did I just do? Which is, it happens quite often actually. We step in and we say, we have the solution. We do abortion pill reversal. So what that is having them come into the clinic, doing an ultrasound, confirming that baby is still viable, alive, and doing well. And then we start them on progesterone right away and hopefully reverse the effects of the first abortion pill. And the abortion pill reversal, progesterone medication is something that's been used for 50 years plus with, really safe side effect profile. We know that it is good for the baby because in high-risk pregnancies, we give it through the end of the first trimester. So something that we've been using for a long time, we know is good for the baby. And we've had 3 successful babies saved from this. So it's super exciting, something I think we'll probably continue to see more of.
Oh, that's so cool. But if you could see the gleam in Samantha's eyes as she talks about this, I mean, passionate about doing this and serving women, serving babies, being on the front lines as you guys are at Stanton Healthcare, and we appreciate you so much. Again, the March for Life is coming up this weekend. There's a March for Life Boise on Saturday. The March for Life National in D.C. is on Friday, and then Sanctity of Life Sunday is, of course, on Sunday. No surprise there. Samantha, just in the short time we have left, I just want to back up the train just a second because you're so passionate about this. How did you first get involved with Stanton Healthcare?
Oh, man. It was just the Lord. I don't know how else to explain it. I honestly was just looking for a job, and I came across a job listing, and I'm not an emotional person, but immediately I teared up and I was like, I need to do this. It was something that I was already passionate about. And I really feel like the Lord just kind of put everything into place. And here I am. And I love my job.
I love it. I love that you love your job because of what you're doing with that. And so many services, early detection of pregnancy testing, pregnancy verification, limited ultrasound exams, options, counseling. I'm reading this from the website. And by the way, the website is stantonhealthcare.org, a great friend of this ministry of The Voice, and we appreciate them so much and what the work they're doing is. It is Sanctity of Life Week on the Finishing Strong program. My name is Steve Tanner. Samantha Doty, thanks so much for your time with us today.
Thank you so much for having us.
I really appreciate it. And we're going to be continuing this throughout the week and focusing on life this week. And the battle's not over. We're still fighting and we're still marching for life. Thanks for listening to Finishing Strong on The Voice. Hello and welcome to Finishing Strong. My name is Steve Tanner on 94.1 The Voice. Finishing Strong, the program that really seeks to encourage all of us, myself included, to finish strong in everything that we do. And this week is Sanctity of Life Week on Finishing Strong. This weekend is the March for Life in Washington, D.C. There's also the March for Life in Boise coming up on Saturday. And then this Sunday is Sanctity of Life Sunday, that you can be a part of that through your church as well. And speaking of that, as we are covering different angles of life, pro-life, we're talking to the wonderful folks at Stanton Healthcare. We've talked to the executive director. We've talked to clinicians. We've talked. We're planning to be talking with a client from Stanton here in just a couple of days. But today we want to really cover another angle of all of this and how this works and what Stanton really is doing, Stanton Healthcare, and that is with churches. And so in our studio right now is a pastor whose church is very much involved, and one of the volunteers from his church as well, who's also involved with Stanton Healthcare. I want to welcome Becky Folk as a volunteer at your church, and then Vinny Hankey from Valley Life Community Church. Vinny is part of the Gospel for Life program that you hear on every day here on The Voice. Vinny, thanks for being here.
Oh, it's our pleasure. Thanks for having us and giving some time, Steve. Thank you.
Well, so often we see things happening. Okay, here's my church. So you've got a million things on your plate, so much going on, just to keep the apparatus operating in the church. But to then get involved with something that's on the outside, something that many of your folks are passionate about. But then to jump in with an organization such as Stanton Healthcare, how did that come about for your church as a pastor, getting your church, Valley Life, involved with this?
Yeah, it's all Becky's fault. Truly. I've said this more than once, but every local church needs a Becky Folk in there, and what I mean by that is an advocate for Stanton in the congregation, to be the voice for the vision and ministry of caring for women who are experiencing unexpected or crisis pregnancy, and that's really what Becky became for us. Our philosophy of ministry is to do any ministry with a passionate, called, and gifted leader, and that's Becky. She's passionate about this. She's gifted at it, and God has called her to it, and it's been reinforced. And so that made it easy for me just to help give her resources and time and energy and effort in the midst of congregation, whether that's verbal announcements or holding events, and just letting her run wild after what God's called her to do.
So Becky, talk about your passion for this ministry, and then approaching Pastor Vinny to get the church involved in a formal way. But talk about your passion for serving with Life and with Stanton.
I think because I'm a mom and I'm a woman, and so just being passionate about bringing life and hope to women, and also compassion to women who are facing these life choices and these unplanned pregnancies that come with a lot of different circumstances, even ones that, we hear about in our stories. But for me, it was just, I wanted to use my gifts and serve as a mom and as a Christian woman, and to advocate for this organization that's doing so much in our local community, and get other people in our church who are great servants of the Lord, but to try to partner with an organization that maybe they're passionate about, but they didn't know it existed.
Vinny, I know you know this, but talk about the fact that when you're standing in your pulpit, when you're delivering a message, when you're leading in your congregation, that there are people out there that are facing this. Maybe they know someone who's going through an unplanned pregnancy. Maybe they are that person facing that, or facing, there's all different kinds of things. People facing depression, people facing, bitterness and unforgiveness in their life, or whatever. But this specific topic of life and unplanned pregnancy, you might not realize who it is, but they're out there.
Yeah, I think the gospel begins, the gospel story begins in the Gospel of Matthew with an unexpected pregnancy, right? With the announcement to Mary that she's going to give birth to the Messiah. So we have a touchstone moment for all women in our congregation who are experiencing that fearful moment. Now, the difference between the origination of the gospel and maybe what they're experiencing, the circumstantially, is certainly different. But it begins for us as pastors to begin to understand with a heart of compassion, and to lead that as we speak gospel truth, that there is hope. We believe in that every single human being has been created in the image of God, no matter what stage of development or life that they're in. And so for me, it's preaching with compassion, and then it's also preaching the truth that each and every single individual human being has worth, value, and dignity as an image bearer of God, and reinforcing that, whether it's the individual in the womb or the woman carrying.
So the fact that there are people that are facing that in your congregation, but also not just seeking to have an impact with the people that you can lay eyes on, but knowing that when you're involved with a ministry like this, like Stanton Healthcare, that you're reaching beyond your walls, so to speak, to make that happen. And so, Becky, I got to think that's a driving passion of yours, to make an impact beyond what you can see and touch but you're seeing this happen in bigger ways.
Right. And so as I got involved with Stanton, I wanted to bring Stanton's ministry and their work into Valley Life. And that was just by talking with Vinny and getting, approval from other people that he's with and the staff and the board, but to help them come alongside me to be excited about it too, to be an extra voice. But yeah, bringing the organization, the work of Stanton into the church so that then we're passionate, we can do things as a church to send out more people to help with the work of Stanton and be excited about it in their communities.
Well, I'm visiting with Becky Folk. She's a volunteer with Stanton Healthcare, stantonhealthcare.org. You can find out more, so much on their website, great resources, ways to get in contact with them. The things that they offer, the services that they provide are amazing and always without charge. I'm looking over at one of the Stanton folks here, and she's nodding, saying, yeah, that's the way you say it, without charge. No charge for any of the services. But StantonHealthcare.org. My name is Steve Tanner. The program's finishing strong. Becky's with me. Also, Vinny Hankey. He's pastor, Valley Life Community Church. Vinny, somebody's driving down the road right now, and they're hearing this conversation. They're saying, ooh, we could do that in our church. What is it? What kind of conversation should someone have with their pastor? I know you can't speak for every pastor, but as a pastor, what does the approach look like that's going to be most effective for someone maybe going to their pastor and they've never done anything like this before?
Yeah, I think that's where Becky really modeled this really well, where she brought something that she was passionate to me and had all the information available. Because that's typically the first thing we have as pastors is lots and lots of questions. And so if you're driving down the road and you've got you think this might be something you want to bring into your local congregation, man, get on the Stanton website, connect with the Stanton staff, get all the information you can so that when you meet with your pastor, you can present all of that to him and be prepared for some of his questions. And then I'd say if you're a pastor driving down the road, listening, man, we know the burdens out in the community and our longing to love our neighbors. What often we lack is the resources to do everything. And that's where having a partner like Stanton is so vital for us. We want to love women. We want to support women experiencing crisis and unexpected pregnancies. But what we don't have is all of the resources to do that. But what I do have is a partner in Stanton Healthcare. What we do have is someone like Becky who can connect those women. And so if you're a pastor out there, don't feel the need to reinvent the wheel or feel like you have to create your own pregnancy ministry.
Right.
Partner with Stanton. Allow the experts and the excellence that they have to do what they do well and free yourself from that burden.
I don't have all the resources. I don't have all the answers, but I know who does.
Exactly.
And I know who to go to. And so, Becky, when you approached Vinny about this and you talked about the process, I'm sure you had all that kind of stuff together. You were ready to go. You were. They're looking at each other here like, yep, she definitely did. She had it all ready to go.
Yeah.
But that's great. And the Stanton website is a fantastic resource. So if you are considering that, and as a pastor, go look at it too and see what's there. And not that you have to necessarily learn every single thing that's there, but when your congregation begins this, you have a partner. It's not you, as Vinny just said, reinventing the wheel, but you're just tapping into an organization that are the experts, that are the ones that are paying attention to all of this. So Becky, tell me what you do as a volunteer with Stanton. What really gets you going when you serve there?
I help Linda Thomas with various community events and fundraisers. So the two biggest, I was on committees for the gala that we just had this past fall, and also coming up, we have our baby bottle drive this spring. And so that really is how I brought the need into Valley Life. Was I heard about the baby bottle drive and I'm like, I think our church can do this and I'm willing to step in and help so it doesn't fall on the pastor, it doesn't fall on the outreach team or ministry team. Like, I can help facilitate this. And so bringing that to Valley Life, we also did tangible things like a diaper drive. So my role at Stanton as a volunteer, you have more eyes and ears of what the immediate needs are and what are the ongoing things happening. And so I just share that and communicate with the pastor to say with Vinny, hey, what can we do with Valley Life
That's good.
Yeah.
And I promise you, I've served as a pastor as well, Vinny, and I know when someone comes and they have a plan and they have resources and they have a way to go, a direction to run, your pastor will rise up and call you blessed.
Yes. And amen.
It's just wonderful to take that, and not just somebody who comes with an idea and says, "Hey, pastor, we need to do this. What are you going to do about it?" But come
Exactly.
with the information, the ideas, and that's all provided for you. You don't have to, just like what Vinny was saying about the church not having to reinvent the wheel with all of this, you don't have to either. It's all right there. Print out some of the pages. I got some of the pages from the Stanton website printed right here, and they're amazingly helpful for that process. So again, man, we're running out of time here. I want to be sure that we hit the particulars here and hit the meat of this. Becky, serving as a passionate volunteer, you can hear the passion in your voice. Vinny is a pastor, Valley Life Community Church. You hear him on Gospel for Life, but a pastor who really has taken this seriously to not just give lip service to life, but really to lend a shoulder, a hand, legwork, blood, sweat, and tears to making it happen, and all under the auspices of Stanton Healthcare in the Life movement. So StantonHealthcare.org, again, you can find out so much information there, and just life in general. I mean, the March for Life is coming up this weekend. The National March for Life is Friday, and Stanton's going to have a presence there. We're going to hear more about that this week as well. And then coming up on Saturday is the Boise March for Life too, and we'll hear more about that this week as well. But Becky Folk, Vinny Hankey, Pastor, thanks for coming in.
Thank you for
My
having
pleasure.
us.
Thanks,
Really,
Steve.
really appreciate having you guys. Again, this is Finishing Strong no matter what you're doing, no matter what the timeline is, be sure you finish strong. Hello and welcome to the Finishing Strong program. My name is Steve Tanner on 94.1 The Voice. This is Sanctity of Life Week, Sanctity of Life Sunday, coming up this Sunday. The March for Life, you've seen that for years and years happening in Washington, D.C. There's also a Boise March for Life. We're going to talk about all of that with my guest. She's from Stanton Healthcare. She's the Director of Community Outreach. Her name is Linda Thomas. Linda, thanks so much for your time with us today.
Thank you, Steve. It's such a joy to be here.
You know, Stanton Healthcare, you may have seen their offices around the area, their clinics, fully accredited healthcare facility. This isn't just a pretend place. These guys, in fact, if you listened to previous times this week and talking about this, Samantha Doty talked about, she's their clinical director. She talked about the lengthy process they went through, that you guys went through to become accredited. So this is real time, real life healthcare going on, and real life, pro-life action going on to help women and save their children as well. So Linda, as Director of Community Outreach for Stanton, you're exposed to a lot of stuff. You're in and around the community and seeing how things are. Talk a little bit about where we are with life, with the life movement right now. Roe v. Wade was struck down last summer, as we all knew, the Dobbs decision from the U.S. Supreme Court. There was a trigger law in Idaho that effectively banned abortions in Idaho.
Yes.
But even though that's all happened, the fight continues, doesn't it?
It does. And in fact, our work is even more critical than ever. Women still experience unexpected pregnancies every day, and they need our support as much as ever, if not more than ever. There's still an aggressive push in the abortion industry to now send women across state lines to get chemical abortion pills right across the border, the Idaho-Oregon border in Ontario. And we have clients that we see even now who've been sent across the border to pick up abortion pills in fast food restaurant parking lots via telehealth appointments.
Wow.
It's dangerous to women. Obviously, it's deadly to babies. And we are here to help and provide the hope and the true care that women actually need and want.
You know, the politicalization of life is a sad state of where we are. I mean, a lot of people equate it to abolitionists back in the 1800s, and
Yes.
and I think that's a fair comparison
Sure.
of the fight continuing for that and for this, for life. At Stanton Healthcare, by the way, StantonHealthcare.org is their website. You can find out lots and lots of information, great resources there. But we have, this week has been for the last 50 some odd years, I guess this would be 50 years
Yes.
since the Roe v. Wade ruling in 1973
Right.
for the March for Life, Sanctity of Life Sunday. It's different this year because of what happened last summer, but again, the march continues. Talk about what's happening. We know about the March for Life that happens in Washington, D.C. every year. We see that footage of, and it's always undercovered in the media.
Yes.
But what's happening right here in the Treasure Valley with the March for Life?
Sure. So the March for Life will happen here on Saturday, January 21st. A large amount of our Stanton team will be there. We invite everyone to meet us there at 12:45 on Saturday at the Jean Harris Bandshell at Julia Davis Park. We're going to be handing out our purple sashes that we wear as a throwback to the suffragists who wore purple sashes as in their fight for women to be able to vote.
Right.
And our sashes proclaim equal rights for preborn women. And as a throwback to that fight for justice, and we continue that fight today. So while in Idaho, we do give praise to God that just recently our Idaho Supreme Court upheld our abortion bans in the state. And so that is now settled. Praise God. However, as I said, there's an aggressive push to get abortion pills into the hands of women, even through the mail, as you may have recently heard, through pharmacies. So local pharmacies and people's homes are now being turned into abortion clinics. And we all just need to be aware of this. We need to be a supportive community for women and for men. We need strong, godly leaders to stand up and show a better way for young men and young women to know that the family is sacred and life is sacred. And so the March for Life is a great place to do that. We will have a Stanton team out in D.C. We are taking some of our Stanton moms and their children out there with us. We have some wonderfully generous supporters who are sending our Stanton moms out there with us. And Senator Warren and Representative Ocasio-Cortez have both been very vocal against pregnancy resource centers, pregnancy medical clinics, wanting to shut them down across this nation. And our moms are so brave. They're going to come out there and visit those offices of Congress with us and share their stories. It's going to be a national campaign that we're launching there called Not Fake to Me. And they are sharing their very real stories with their very real children. And we're going to invite those Congress women to come and visit us at Stanton and see the services that we provide to these women and their children.
That is so cool. And what a high road way to approach it too. Not lambasting them, not calling them names, not getting into the gutter.
Yeah.
And not fake to me. What does that come from? Not fake to me.
Well, it comes from our clients. It's their voices. They want people to know that when they were in this crisis and they didn't know where to turn and they came to Stanton, the services they received were very real and their children are very real. And so the abortion lobby and politicians and the media have been labeling clinics like Stanton as fake clinics. And as you brought up, Samantha Doty, our physician assistant, shared that we have AAAHC accreditation. It's a third-party accreditation for ambulatory health care. We have more medical covering than Planned Parenthood does. They are self-accredited. And so we hold ourselves to a very high standard because that's what women deserve.
And you also, your services are provided at no charge.
They're provided at no charge. Women don't pay a dime for anything, and we don't want them to. We get no federal or state funding. Everything comes from the community, from individuals, from churches, from businesses that support the life-honoring work that we do.
Now, some of these women, I don't know if any of these specific women would be involved in the Not Fake to Me campaign and going to see those legislators, so those national Congress people, representative and senator, in those cases, as you mentioned. But talk about someone who would testify that this is not fake to them.
Yeah, absolutely. So another thing that we're raising awareness of is chemical abortions, because nearly 60% of all abortions in America are now through pills, through these chemical abortion pills. And we offer abortion pill reversal. And one of our clients who took the first abortion pill inside Planned Parenthood in Meridian, this is before the ban took effect, she was bawling her eyes out in the clinic the day that they were giving her the abortion pill. And she shared with us that no one ever even asked her if she was okay. No one ever asked her to take a pause, and maybe this wasn't the time to be making this decision. So she took that first abortion pill, left the clinic, and in the middle of the night Googled, what can I do if I've taken the first pill? Did I hurt my baby? And a number came up. She started texting it. The very next morning, a Saturday morning, our physician assistant met her at the clinic, did an ultrasound. Her baby was there. Her baby's going to be turning a year old this spring.
Oh, man.
Yeah.
That is a powerful story. So Stanton Healthcare, this kind of healthcare, not fake to her and her child. And that child's going to grow up with a story to tell of what happened in starting its life as well.
Yes. I want to share super quick, Steve. I know our time is short. We know that there are women suffering from the pain of a past abortion as well. And we offer after abortion healing, Bible studies, retreats. I myself had an abortion. It's why I'm doing the work that I'm doing now. January 15th, 1993, 30 years ago, is when I lost my child to abortion. And I remember it every year. And I don't want any other woman to have to go through that same kind of grief. So we do offer after abortion healing and recovery at Stanton.
You know, the mantra that I hear, and we've all heard, and you've heard it way more than I have, is, oh, you guys only care about that baby, and you're not going to care anything about that baby after it's born, and you don't care about the women. This is anti-women. And that's just such baloney, isn't it?
It's complete baloney, and I'm so glad that you're also sharing radio time with one of our actual clients during these segments, because they would have something very strongly to say about that. We walk with these women. We love them. They become family. Across the board, they say, you know, if you could sum up Stanton in a word, what would it be? And so many of them say family. Yeah.
Well, Linda, thank you for, and just what you just said about your own experience. Thank you for taking the pain from your past and turning it into hope for the future.
Yeah, that's the Lord.
Yeah, amen.
Yes.
Amen to that. God does that in so many different ways, and in your case, involving many that you are touching now through this ministry at Stanton Healthcare, and lots of different ways to serve. Stanton Healthcare being one primary way in our area that we're so blessed to have. StantonHealthcare.org. Check them out. Go online, and you'll see an outline of ways to be involved, not just be a client, but ways to be involved with this ministry going on at Stanton Healthcare. Real healthcare. It's not fake to me. It is very, very real. And so this weekend is the March for Life. So nationally, it's on Friday in Washington, D.C.
Yes.
And then for the Boise March for Life, it is Saturday, and your gathering with the Stanton folks is going to gather at Gene Harris Bandshell at Julia Davis Park, 1245 on Saturday to get ready for the March for Life.
Come get your purple sash and your Stanton sign.
All right. Well, Linda Thomas, Director of Community Outreach, Stanton Healthcare, thank you so much for your time today.
Thank you so much, Steve.
Really appreciate you coming in and helping us arrange this whole week of Sanctity of Life Week on the Finishing Strong program. No matter what you're doing, as the Apostle Paul says, my only aim is to finish the race and complete the task the Lord Jesus has given me. That is finishing strong. I'm Steve Tanner on 94.1 The Voice. Welcome to 94.1 The Voice. This is the Finishing Strong program. My name is Steve Tanner. Thank you very much for listening. All week long, we've been talking about life, Sanctity of Life Week. This Sunday is Sanctity of Life Sunday. The March for Life. In fact, the Washington, D.C. March for Life happening today. The Boise March for Life is tomorrow, as you hear this on Friday. In fact, my guests now, we're pre-recording this program because my two guests are going to be in Washington, D.C. today. They're up there right now as you hear the program. So I want to welcome back Linda Thomas, she's the Director of Community Outreach at Stanton Healthcare. We've been talking to various folks from Stanton Healthcare all week. So Linda, thank you for coming back.
Thanks for having me back.
And then she has a friend with her today as well who I want to welcome to the studio. Her name is Leandra. Leandra, thank you for being here.
Thank you for having me.
Linda, why did you bring Leandra with you today?
Leandra's here because she is a beautiful representation of what we do at Stanton and why we do it. We love her so much. And Leandra, why don't you just share with everyone what was going on in your life when you came to Stanton and why you're here today?
I had the classic 2 blue lines where, the whole world comes crashing down on you and you have no idea what you're going to do. And when you don't have health care, when you don't have insurance, and when you're facing that situation, especially with an unsupportive situation, it can be extremely scary. I reached out to a friend and I was like, hey, so I just found out that I'm pregnant and I have no idea where to go. She recommended I go to Stanton, and I walked in there. I got a free pregnancy test, free health care, a free ultrasound, and the best care from those ladies I could have ever asked for.
Now, when you walked into Stanton Healthcare, did you know they were a pro-life organization, like they advocate for pro-life causes?
Funny enough, it actually was probably 6 months of going there before I had any idea that they were pro-life. They were just so supportive of life and so supportive of pregnancy, of women in need. And when I found out about how pro-life they were, I was so astounded and just amazed. They do so much incredible work.
So Linda and I were talking in a previous program this week about the kind of the label that's given to pro-life healthcare as being fake healthcare. Some in Washington would say that, some politicians would say that, some in the media might say that, but it's not fake to you, is it?
It's not fake in the slightest. There have been some very real nights I've gone in and held my daughter. One of the only reasons that I have my daughter is the support from Stanton. I had many people around me telling me that an abortion was not only the best option, but the right thing to do for the situation I was in. And Stanton was one of the only people that I had that supported me, that offered no judgment, that said, well, regardless of everything going on, what do you want to do? Because we can help you do it.
Now, you mentioned that you were in an unsupportive situation. Can you unpack that a little bit? What was going on?
I had family members even who were coming to me telling me that abortion was the right option, that there was no way I could raise this kid, that if I were to go through with the pregnancy, somebody else was going to have to raise my daughter, as well as the father, having somebody barter with you to try to get you to get an abortion. That was hard.
Yeah.
I felt guilt. I felt shame. And I felt like I owed it to somebody. It was a very tough time.
Yeah. I can see in your eyes the emotion of all of that. When it came to that moment where you did step in the door at Stanton Healthcare, how vulnerable were you in that moment?
Extremely. Extremely. I think that was the most vulnerable I've ever been in my life.
And so in that moment, it really would have been, you kind of were on the edge, and it would have been easy to flip one way or the other, but you had the encouragement to go through with your pregnancy, to go through with life. Talk about what happened next. Talk about how the pregnancy progressed, and talk about your daughter.
So when I had gone into Stanton the first time, I remember I was just a frazzled mess, and Angie stopped me and she's like, hey, we have resources if you want to keep the baby. We've got all of these different things that we can do to help you. Take the week, think about it. I went home with a baby blanket and an ultrasound, and I ended up falling asleep that night with both, just holding it and cuddling it. And as I started to really adjust to being pregnant, and I really loved the idea of it, I just remember every single moment of each new thing, each part of the life growing inside of me was just such a beautiful blessing. It changed my perspective on the world. Honestly, I started to see things differently.
Give me an example. How do you see things differently now having had that change of heart, change of perspective on life in the big sense, but your life?
I think the biggest has been purpose. I went from having no purpose to having one every single day. I get out of bed and the first thing I get is a smile and somebody's eyes who light up at just seeing me. And there's something so special about that connection and that unconditional love.
So the pregnancy went well, and you delivered your daughter. By the way, I'm talking to Leandra, and along with me here too is Linda Thomas from Stanton Healthcare, stantonhealthcare.org. This is the Finishing Strong program on 94.1 The Voice. I'm Steve Tanner. But Leandra, talk about having your daughter, and I want to hear something about her. She's how old now?
She is 16 months.
16 months old, and the apple of your eye, the light of your life, the smile you see in the morning. So talk about your daughter. Tell me about her.
She is incredible. She just learned how to walk, and she's an unstoppable force. And she loves to talk. Right now she mimics a lot, so she'll look at me and she'll be like, "What's that?" Or I'll ask her, "Are you done with dinner?" And she'll say, "I'm done." It's incredible watching her go from this tiny child into this actual child. She is starting to really just explore the world. And it's incredible. Children really show you the world again through new eyes. You get to see everything through a fresh set.
Getting behind her eyes. Yeah.
Exactly.
Okay. If someone's listening to us now, they're in their car, on the interstate, or they're at home, they know someone or they are someone who's in the situation that you were in, what would be the first thing you would say to them?
It's never what you expect, and it's never what you're told. There are so many fears that get thrown at you around pregnancy and around children. And one of the biggest ones is that you won't be able to afford them, that you won't be able to give them a good life. And that was one of the things I was most terrified about with my daughter. One of the reasons I was so thankful that I found Stanton. They've helped with my daughter for more than just my healthcare needs. When you think about having a child, you think about 18 years of responsibility and a weight on your shoulders, when in reality it's 18 years of having this friend, this beautiful child who gets to grow into an amazing adult. The responsibility feels weightless, and all of the fears that you have, they disappear.
Now, your challenges, you still face challenges every day. You still have rent to make. You still have a job to keep and all those things. So it didn't just suddenly, all that stuff just disappear. But your perspective on how to approach all of that changed so dramatically. What's different about Leandra today than Leandra the day before you walked into Stanton Healthcare?
Leandra today is a mother, and happy to be.
It doesn't get any better than that.
No.
And Leandra, you've worked really hard to get where you are today. Like Steve said, it wasn't just some magical thing that happened. What are some of the things you did to improve your life?
I went through an insane change when I found out I was pregnant. I was pretty much a borderline alcoholic. And the day I found out that I was pregnant with her, I got into classes, I got into different programs. I started seeing a wonderful counselor. I've been seeing her for almost 2 years now. I just did an overall life change. I got a good job. I've been at a steady job for the whole time, pretty much since that point. It was a really big motivator for me to get my life on track.
You know, I see you guys, Linda Thomas from Stanton Healthcare, and then Leandra. I see you guys, look at each other with a knowing glance. I mean, you know one another. You had an unsupportive situation when you came in. What was that? A year and 8 months ago, or sort of 16 plus 8, whatever, however many months that is. Never do math live on the air and radio. But when you first walked into Stanton Healthcare that day, you've had support. You weren't being supported up until that time, but you've had support. What would you say to someone who has someone in their life who is going through what you were going through, who is facing an unplanned pregnancy? How do we support that person?
You ask them what they want, because 9 times out of 10, that person what they're feeling, they have a hard time voicing it because of everything else that's being thrown at them. Mm. And most people, they want to have the baby. Mm-hmm. When you feel that life growing inside of you, there's just something that changes. And it's very difficult when you're being clouded by so many outside things to feel like you even can have your own thoughts about it.
Wow. That's powerful. We're out of time. The time always goes too fast on this program, Leandra, but thank you so much. I know that the day this airs, you guys are actually in Washington. Will you come back and tell us how that went and what you learned and how amazing that experience was?
Yes, please.
Okay,
we'd love to.
We'll have you back soon. Linda Thomas, thank you so much. Arranging all of this week to help us tell the story and walk through Sanctity of Life week here on the Finishing Strong program. I appreciate you so much. And Leandra, thanks so much for coming by. Your beautiful red hair and your smile and your eyes are just aglow. And it's wonderful to see, and we really appreciate you coming by.
Thank you so much.
And again, if you want to find out more about Stanton Healthcare, go to stantonhealthcare.org. Thank you so much for listening to the Finishing Strong program. That's what we're about, is finishing strong. Leandra finished strong, and she's continuing on a pathway of finishing strong in her life. And you can do that too, and that's why we're here. Thanks so much for listening. I'm Steve Tanner on 94.1 The Voice.